welcome everyone. Oh, we've got, I guess, admitting a couple of people here. So welcome everyone, and thank you for coming. I'm Sharon Scaling, and I am the Capacity Development Coordinator with the MSSU, and I oversee the Training Support Program. So I'm happy to be able to share some information that hopefully will help with your applications. So what I'm going to do is I'm going to go through the presentation, and then we'll have time for questions afterwards. That should work for everyone. And I'm going to put my screen so that I probably can't see your hands, because I want to. Yeah, I do want to make sure that it's recorded okay for folks. So we'll get started. The Trainee Support Program comes from from our Maritime SPOR Support Unit. SPOR is the strategy for patient-oriented research. And it is a national CIHR initiative. And it really is about focusing on what moving health researchers know into what they can provide. And that is the key about what we want to be doing. Just give me a second. I've got a few people that I have to admit here, so I'm going to pause for a second. I think we have everyone. So it's an important initiative and one that we're proud to be a part of. There are 4 guiding principles for SPOR, that it is patients should be involved in all aspects of research. Decision makers and clinicians should be involved throughout the research process. It is a multidisciplinary approach, and there are considerations of equity, diversity, and inclusion, and making things accessible to folks. And that is something that we're looking at for our future applications, is including that. So that's a new thing, which is exciting. There are 11 CIHR-funded provincial territorial units across Canada, and they were designed to provide decision makers and healthcare providers with ways and means to connect researchers with patient needs, so that evidence-based solutions can be applied to healthcare and then shared throughout the country. It's a national initiative, and as I said, it is across the country, and we are one of those units. We are unique at the Maritime SPOR Support Unit in that we are the only unit that covers 3 provinces, so New Brunswick, Prince Edward Island, and Nova Scotia. And I'm pretty happy to say that I think there's representatives from all 3 provinces on this call today. So that's great to have that representation across the Maritimes for this. So now let's get into what you really want to know about, which is the Trainee Support Program. So it's been going on for 8 years, I think, and it is for supporting the development of the new generation of health research leaders and health researchers with expertise in patient-oriented research. So everything really is about patient-oriented research, building capacity for master's, PhD, and postdoc trainees. And really, it's open to a wide variety of themes. Any human health themes are eligible, as long as it is patient-oriented in its concepts. So a few requirements that this has. First of all, relevant to the MSSU, biggest thing is patient-oriented research. And how it is POR is going to be a key piece of the work that you need to put into your application. How is patient-oriented research going to be integrated throughout the research project? New to this year is that you have to address a health research priority in the province in which you live. Those priorities are listed on the program overview on the website. When you are writing your application, there is a spot with all of your name, your supervisor, and then it says, what is the health priority? Make absolutely clear how your project links to one of those health priorities. Don't make the reviewers going looking for it. So make it really clear. If it's, I know one of them in PEI, I believe, is access. So expand that out a little bit, but make sure you tie it so that it's easy for us to be able to see the link between your project and the health priority. What is the impact and relevance to the patient population is important. It doesn't mean that your project can't have a broader scope than the Maritimes or the province that you live in, but it does need to have impact in that province. So that's an important piece to keep in mind, and how you're going to measure outcomes. Those are all things that we're going to be looking for. Couple of changes this year. You are not required to submit a letter of reference. This has been a bit of a challenge for some of our international students, some of our first year who don't have a supervisor necessarily in the past. So we've decided to eliminate that. It takes away that barrier. If your supervisor wishes to submit a letter of support, that is optional. It is not required, and they're more for MSSU purposes, and they come directly to me. You do not have to submit your transcripts, which is really new. We figure if we need them, you have to submit them to university, and we'll figure out how to get them, but you don't have to worry about gathering that information. We really want you to focus your time on writing your proposal as opposed to tracking down documents. We do require your CV, and there's two options for your CV. There is a format that's included on the website, on our website, that you can use. It's a Word document, and you just fill in the blanks. If there's something that isn't applicable, just put not applicable or not available. But fill it in every section, so you can do that. Or if you have a CCV, a Canadian CV, and the link is on the website with the information about that, you can use that as well. It's pretty much the same format. The advantage to using the CCV, which is through ResearchNet, is that that's saved there. And so you can continually update it, and it's saved on that, and you can reference that. Either one of those is fine. We're not looking for a resume, that anything else. We want everybody's to have the same format, and that's partly because it makes it easier for the reviewers. They know what they're looking for, and they can find it immediately. Keeping in mind, you have a group of reviewers, and I'll talk about the review process shortly, but you want to make things easy for them to find. They're donating their time, and we want to make things as easy for them as possible. So there's a place to upload your CV when you do your application. Something else that's new for those of you who may have applied before, if you haven't gone in, you can start your application and save it, which is a feature we added this year with a new website. We were able to add that, and then you will be emailed a link to go back and get that and continue on. So if you want to do part of it, and then you don't have to do the whole thing, you can cut and paste it from a document and save it, but and do save yours, but you do have the opportunity to save it on that site. I think it's for 30 days. As in the past couple of years, we have required that we have MSSU scientists as your supervisor. I know that there's a few new MSSU scientist applications coming in, so I'm anticipating that they're going to be coming along as supervisors for you, so that's awesome. And then you also need to have some form of a patient partner engaged. And it says throughout the project as a team member. It doesn't have to necessarily be throughout, but we need to be clear how they are involved. And I would anticipate that the further along you are in your career, that you would have more involvement. And I'll talk a little bit more about how you can engage your patients in that and what that means. and a health knowledge care user. And there's a definition there. I've put the link there from CIHR, what that means. And it's someone who is basically able to use the research results to make informed decisions about health policies, programs, and practices. So they can be engaged in a number of different ways, depending on the nature of the research. So they don't have to be, they could be advising on the research methods. They could be advising on recruitment. They could be advising on the KT plan. They can be a practitioner, a policymaker, an educator, a decision maker, a healthcare administrator, a community leader, an individual in health charity, a patient group, private sector, media. There's lots of different places, and usually within the context with your supervisor, they'd be able to lead you to what that should look like for your project. So things that you need to be able to include in your application are that plan on how you're going to engage that knowledge user in your project, a patient engagement plan. So how your patients will be engaged as partners in the project. And it's really important to separate partners, patient partners. They are also called people with lived experience. There's lots of different names. We're still using patient partners because CIHR is using that terminology, but a lot more people are using people with lived experience. If you're not familiar with the term of patient partner, make sure you go and look at the website CIHR and look at a little bit more of that. And I'll also provide you with a link for a training that might be helpful. So patient partners are not participants in the study. They're not subjects of the study. They are part of the research team. And that's what's really important. And that's what we want to know is how you're engaging this person with lived experience in helping you co-design and define what your project is. A knowledge translation plan. And there's also a place for the description of sex and gender considerations, and that's laid out in your in the application. And there's some tools on the website to help you with that. So all the key documents are listed on the website. I'm sure you've all been there because you all knew where this is and knew how to get registered for this. So there's an overview that you can download with all the information. It also has your health priorities for each of the 3 provinces. There's your proposal form, and there's a self-identification form. The self-identification form is for our purposes. Nobody else sees that. In fact, I'm the only one who sees them. And it is in terms of confirming that we are being as equitable as possible, that we are drawing from diverse community, and we're also how that's being awarded and whether we need to, it helps to guide us whether we need to market in different ways. So far, I'm really pleased with how things have gone, but you are not required to fill it in. If you're not comfortable, you can put in parts of it, and there is a space for everything of I prefer not to answer, and that's totally fine. But I will let you know nobody sees them but me, and I don't even keep the names with them. I code them so that it is kept very private and confidential. Eligibility, obviously, have been applied, accepted in, or enrolled in a full-time thesis, master or doctoral program, a postdoctoral fellowship under the supervision of an MSSU scientist at a university, college, or institution in New Brunswick, Nova Scotia, or Prince Edward Island, and be engaged in research activities related to patient-oriented research. We do not limit what year you are in your program. Sometimes people don't fund in a final year or the final 2 years. We're not limiting it to that. As long as we know that you have the time allotted, if it's a 2-year funding, that you have 2 years left. If not, we take the money back. So, there you go. So it's pretty simple, and I think it's pretty well laid out. And most of your grad departments know these requirements already. I know a lot of you are from DAL, and I definitely know grad studies, they reach out to me frequently to confirm eligibility and things. Again, the funding, it's non-renewable, and it is issued in masters up to $10,000 for 1 year, doctoral $15,000 a year for 2 years, and postdoc $20,000 a year for 2 years. So when I say non-renewable, if we funded you, we won't fund you again for the same project. So just keeping that in mind. So now let's talk a little bit about what patient-oriented research is. And it is what's called a continuum of research that engages patients and their providers. So when we use the term patient partner, it's a very broad word, and it can mean family, caregivers, community, anyone that has a relationship with a person who has the condition. And I don't even like to use condition because it's not always a disease, but I'm going to use that word knowing it's a much broader term, but has awareness of that and can support and understand the needs of that person, that community, that part of what you are researching. It addresses patient-identified health priorities. And that's really important. And that's why you want to make sure that you are engaging a patient partner in some way, because you may think, I want to do this. You engage a patient partner, say, that's a great topic, but we need to do it like this, because that's going to have more meaning for us. And so that's where a patient partner can really guide your project into what area and how you can focus it. They can help with your research questions. They can help with recruiting. They can really make some differences there. And of course, it aims to improve patient outcomes. And, we always want to make sure that it will actually improve healthcare systems and practices, which is why we ask what you think the impact would be. So when you think about it, is a partnership, and it is with and by researchers, patients, healthcare professionals, and health system decision makers. And that's working as a team. So when you're thinking about this, these are some questions that you can ask yourself. Do you have patient partners on your team? At what levels and stages are they engaged in? If you've done any of our MSSU POR training, or I'm going to give you a link for another one, there are levels of engagement from just kind of inform, consult, empower, collaborate, and you don't necessarily have to have patient partners involved in all of those phases. And it's also going to depend on where you are in your research career. As I said, at a first year master's is going to have a little bit of a different context than, a postdoc fellow who has more research, has more experience. So consider what would be logical for your project. Have they helped identify the research topic or questions? Is there a place where they can have some decision making? Are they co-building? It is a big word, co-building, co-design with researchers, practitioners, and other decision makers. Will they be involved in, figuring out good outcome measures, how they will be measured, and how are they engaged in sharing the results of the research? So are they part of the KT plan? And in some cases, they may be part of forming the research question and then disseminating at the end. And that is totally fine, depending on your research project. So yes, you want to make sure you've got those plans, how you're going to include them. I've given you a couple of links there. They're on the website as well. Anything that I'm going to send out the recording of this, and I can send out we'll put the handout as well and make sure that those links are there. There are some guides in terms of how you can find patient engagement plans and project planning tools and KT planning tools. So they're all available. You don't have to make anything up. Those things are available. We don't want this huge amount. We just want to have that you have some ideas and concepts of how you are going to do these pieces. Again, as I mentioned, justification of sex and gender in your proposal. All of this is now on the website. This was brand new last year and it wasn't all up, so I left it in there. But I think it's pretty clear. This is a link to CIHR there. There's a really great flow chart of you can follow along to confirm whether you need to, what action you need to take, how you need to do it. And again, that's all included on the website as well. All of those links are there. So we've tried to make everything really available for you. How we're going to be evaluating this. We've made some changes this year. We always tweak things a little bit. So the evaluations are done. First of all, all applications come into me. I review them and confirm that they have those pieces that we're looking for, that the CV format is the format that we want, and that you have identified the health priority, that you have a patient engagement section, knowledge translation, all of those sections. I'm not a researcher. I'm not reading your project. I'm reviewing it to make sure you have the pieces. I do my checkbox and then it goes off into a file. Another person on MSSU staff reviews that. Something different from New Brunswick and PEI, if you've been engaged in this before, all of the projects come to me out of the Halifax office, and then New Brunswick is done a little bit differently with Research New Brunswick is our administrator, and Research Nova Scotia is our administrator for Nova Scotia and PEI. But basically, we go through internally, we do a review. And then we have a team, a selection committee of MSSU scientists, and we engage them in reviewing the proposals. And they will be given a rubric to evaluate based on these things. So your project description is really important. 40%, huge amount. You know, the quality of your project, how you've integrated patient-oriented research into your project, the potential for relevance, so the outcomes, and then we've included sex and gender in there. Case for MSSU funding. I can go through a lot of things, but the bottom line is, why should we give you money? You know, what is your interest in patient-oriented research? What is your history? What do you know about it? How do you feel patient-oriented research is the research method that we should be using? Okay, so why does it matter? And then your plans. And your alignment with your health priorities. So it's pretty simple, pretty fair. And then the reviewers, then each application has 2 reviewers. And then after that, they're all scored and we tabulate all those scores, set a point, and I never know what it's going to be, that assert what number above whatever percent goes on to a selection committee of patient partners, and they are MSSU patient partners. And they review the patient engagement plan and the knowledge translation plan, and then they score it. And then the highest scoring ones then go to a selection committee meeting where each proposal and I can never tell you what the number is because it's different every year, that is then they make recommendations, they defend, and then make recommendations for funding. So a little bit of support. If you have not already taken this, and this is something that funded trainees are required to take, but it is available for free for everybody. And that is the CIHR, IMHA, POR Foundations Training. They're online modules. And there's ones for researchers and there's ones for patient partners. They're 4 modules. They take no more than 2 hours to do overall. You get a certificate for it. And it's a really good background in understanding patient-oriented research. So we highly recommend that. We require that for all of our trainees, and our staff are all required to take that training. There's also a POR practicum. There is not one before the end of March, but you do not have to be a funded trainee to attend these things, and members of research teams can attend them as well. Other things that you will have to do if you are funded is we have training in EDIA, sex and gender, and Indigenous allyship and engagement. And so you are required to take those. And then if we have any events that we want you to present at, then we would have you engaged in that. And there will be a summit next year in 2024, fall of 2024, I believe. And it's a learning health system summit. So we're in the initial planning stages of that, but we would be potentially engaging our trainees in doing that. Additional tips: pay attention to word count. So really keep it as concise as you can, and watch that word count. Use lay language, no scientific jargon. Your application may be reviewed by somebody who isn't an expert in your field, and patient partners who may not have expertise in that. So keep it at lay language. That is one of the principles with patient-oriented research, is that we want to make it accessible to everyone. So it's not at that high scientific level. Use the CCV or resume format that's on the website, our website. There is a video, if you haven't seen it, it's awesome. I do have time to play it. If it does, do you want me to play it, or have you folks seen it? Maybe somebody can chime in with a hand up or something, what you think. Does anybody care? Okay, thanks, Julia. I'm just gonna switch my screen. And
it took me approximately a week, but if you do not have a Canadian Common CV, you would need much more time.
I would say probably in total, I spent maybe 1 to 2 weeks working on it. Not fully that time. If I had to put it into hours, I'd probably say, I don't know, maybe 8 to 10 hours over that time frame.
So if I was recommending for people who are newer to research, or maybe aren't as experienced or don't already have a CCV, I'd give yourself a month at least.
There's a couple places, like the MSSU website itself has some information about best practices for patient engagement, but also CIHR has lots of resources on that about what it should look like, and different considerations and things like that. And so I found, first of all, just reading that for my own knowledge was really helpful, but also incorporating some of that language into my proposal and into my application, so that I knew that what I was doing was kind of best practice, and wasn't just, crossing off and like checking off the box kind of thing, but was something that I could actually implement going forward based on, what's been proven to be effective or helpful.
So I used a few different resources as I looked at your guys' website and some of your core priorities and your mission to make sure it aligned with those priorities. I also went to the CIHR site, and they had some recommendations around patient engagement plans, and I did some research into similar research and the type of plans they had for like peer-reviewed journals. And then I just try to use what I know about our patients and my experience with our patient population to meld those ideas together. And I know there's a lot of students that I work with, or that I've had discussions with, that their work fits very well and they didn't know about it. So I guess letting more students, especially work who is in straight medical, but has medical implications, or they don't think of it as medical, but it is, because maybe it's access or it's health equity.
Other resources available through MSSU that I found really helpful. I was thinking about planning like a scoping or systematic review, and I was able to request support from MSSU and meet with someone to talk about like just my original ideas and what that could look like, and get some support. And so it was nice to have that avenue.
Obviously the financial support to make it easier to attend school and less worrisome. For me, I've ensured that my students and my staff get the training opportunities I'm getting. So not only am I getting the training to make sure we do it effectively, we're able to spread that out and have more highly qualified personnel being trained through this opportunity. And they're excited about what they're learning. I'm excited. So it's just been really a trickle effect for us, where it's just a spreading activation of knowledge, and hopefully it has impacts moving forward for our research.
It's really cool for me because MSSU is really dedicated to patient-oriented research, and that is a passion of mine as well, and something that I try to embed into all of the research projects that I do. I think sometimes there's this fear about what it can look like because we want to do it right and we want to be intentional about our patient engagement, and we don't want to be tokenistic about it. And those are all, I think, valid fears and concerns and things to consider. And so what I've really appreciated about MSSU is the support that they are willing to offer in terms of like setting up those types of plans and thinking through those things. Yeah, I think it'll be helpful to have a variety of perspectives, because it's, it's all, the more perspectives, the better. Sometimes it can be a little scary to have all those perspectives and try to be incorporating all of them, but ultimately you get, I think, a much richer product at the end of it, which is really helpful.
We do some patient oriented, but we really want to flip into making sure all of our research, not just patient oriented, but patient led. And this really helps with me getting the training and learning to make sure I'm doing that as effectively as possible.
There. So awesome when you have this group of people who are really keen to help. I see there's a question in here about the CV, and I will do that. I think there's only a couple of slides left, and I'll just go through those, and then we'll timelines. I think that's really clear. March 22nd for your application and any letters. 2 o'clock is the deadline. The website will not accept an application after 2 p.m. on the 22nd. So don't don't delay beyond that. Don't think, oh, I have time. Make sure you have it. Early June, we haven't, it all depends on how things go, but early to mid-June, there'll be the decisions. Letters go out from either Research New Brunswick, if you're in New Brunswick, or Research Nova Scotia, if you're in Nova Scotia, and PEI, and they inform of funded, non-funded, whatever the decision is. So those all go out. I'm going to share another screen here with this. Let's bring this up. So here's the website with the thing, and I just saw somebody that said that the CV wasn't there, so I just want to. Oh, it's a downloaded. That's why. You should be able to download it. So hopefully that'll work. And it looks like this if you want to use the format that's on our website. So it'll download for you. And then the other is if you want to do the common CCV, this is just a reference of how to use it, what you need to do. And I think there's a link there of setting one up, but if I'm pretty sure, yeah, you can, there's plans there too. Look, guide to plans, there are all kinds of good things. I see, I haven't even looked at this because Columns did this for me. So I think both of those work. Hillary, hopefully that'll help with the answer to your question there. Just it should download for you. And can those with other funding? Yes, you can apply with other funding. We do not discriminate based on other funding. It's the, I'll answer these questions one by one. So we don't discriminate against that. Please make sure if you have other funding that you do put that on your CV, but we don't look at it and say, no, you shouldn't because of that. We are looking at the proposal itself, the quality of it, the feasibility of it, and please keep feasibility in mind. If you're project is, I mean, we talked to one student and we were like, that's a PhD project. Like you got to narrow it down for a master's because the reviewers are going to say the scope is too big. So narrow it down. Fortunately, their supervisor was saying the same thing. Do you have to have been involved in patient-oriented research before? No. You do not necessarily have to be involved or have research experience, but you do need to explain how this project is patient-oriented and why you want to be engaged in patient-oriented research if it's new to you. So hopefully that helps. The correct template funding, I think I brought the one up, and is the for the template, there's a general one for the CCV. I'm pretty sure it's general. I know that's what mine is general. I can make a point of that, and when I send out the link with the recording, I can make sure that that link is in there too, but I'm pretty sure it's general. No, you do not require supervisor CCV. As they are MSSU scientists, we already have that information. We have all the deets on the supervisors already, so you don't have to worry about that. All right, I'm open for questions. Either put them in the chat or raise your hand and ask if how many are awarded? I can't say. I mean, I can tell you how many you could look on the website and see how many were funded in the past. It is not always clear until we go through things. The past 2 years, there have been a total of 10 awarded between New Brunswick and Nova Scotia. As long as your supervisor is an MSSU scientist, we don't look at what their area they're in. So they have to be an MSSU scientist. And if they're not, there's an application on there. Patient partners and knowledge users, if you know their name, include it. In some cases, it may be that you don't know them yet, but if you do know them, you can include that on the application with other members of the team or something of that nature. I think I do not need their CV or their experience. That's a good question. Sorry, I'm not reading it out loud. Should the project be completely mine as my thesis, or can it be from my supervisor lab project that I lead? I think that it is okay to do that. If I had one of the trainees, it's a lab project that she was funded on. So it would certainly be worthwhile taking the time to apply. I always say, like, it doesn't, if you don't get funded with MSSU, if you've gone through the process of putting together an application, that can be used by so many other places. You can use that with CIHR. You can use it for, future of learning how to do that. So I think if you have the time, I would go ahead and do that, Nita, and make how it is yours and how you're leading it. Like if you're leading it, then how you are doing that, because that shows your supervisory skills as well. Julia, I'm going to be meeting, the question is, will they receive the letter of support if we include one? I'm going to be meeting with the review committee prior to sending out the applications, which I haven't done before. And that's one of the questions that I'm going to have for them. I'm leaning to, I don't know. I think it's going to depend on how many we get, to be honest with you. But I think it's more, it's more internal, but I will be asking. I'm sorry, I can't give a more confirmed answer than that. And you're welcome to chat with me privately, Julia, if you want to explore that. But I am going to be meeting with the reviewers and get clarity around absolutely what they want and how I want the things scored, and that they have to provide feedback. That's another thing that we have them do, is when they do their scoring, they also fill in a template with their feedback in terms of what was good and what needed to be improved. And then students are allowed to get that. Thanks, Julia. If a PhD will involve 3 projects that are all POR focus on the sometimes shall explain all 3 connected projects or just one? Good question, Amy. 3 projects that are all POR focused on the same topic, should the application? My concern about all 3 is that, if they're connected, it's a question maybe your supervisor may be better able to answer than me. The question is always for the reviewers is this feasible for this amount of work to be done at this level? And even though we are funding a PhD for 2 years, you maybe still have more than that, and they would know that if you're, depending on where you are in your degree. It certainly shows a lot of initiative to do that. I would have a good discussion with your supervisor around that. I can't, with that information, I can't tell that much more, but they may be able to guide you a little better than I can on that, hopefully. If there's a co-supervision and the supervisor that is in a different province in the institution, then they blah, 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 which from, yeah. The province in which you attend university. So if your supervisor's in Dal Halifax and you attend Dal St. John, or vice versa, it's the one in which you attend university, because the administrative funds go to that university. And so it has to be done either out of RNB or RNS. The purpose is really that we don't define what the purpose of the funding is. It is not, it can be used to cover research expenses. It can be used, and actually, Alyssa, if you're on the call, you may have something more to add for Research New Brunswick, because I know you require a funding statement and Nova Scotia doesn't. So I'm wondering, Alyssa, if you can speak to that question for New Brunswick. Is funding provided as a stipend or to cover research expenses?
I guess it would be whatever is kind of approved and reviewed by the review committee, like whatever they felt that was justifiable based on the project, we would cover. We don't cover any overhead type of expenses,
Yeah.
but anything else that the review committee would have deemed justifiable would be considered justifiable in our mind.
Okay, thank you very much. Alyssa is our contact with Research New Brunswick, so thank you so much for that. So the priorities are listed. I'm gonna go back to it. So you find everything under Get Involved, Do Research, and then scroll down, and then you'll see the program, and then Apply Now. And then you'll go down to the program guide. And on the last couple of pages of the program guide are the research priorities for each project: Nova Scotia, New Brunswick, and Prince Edward Island. And this is downloadable, so you can keep it. You do not have to include a budget plan. Nita, are you a postdoc by any chance? Yeah. And we don't, because we've only started funding in Nova Scotia postdocs. This is our third year doing it, and before it was master's and PhD. And master's certainly didn't have anything in terms of a budget line, for patient partners or anything like that or anything else. It wasn't. So we decided we were going to carry that over and have it for all. I mean, if you have one and want to include it, fine, but it is not required. And I don't think I wouldn't worry about it. And I look forward to seeing your projects. It's exciting. We've had a couple, and it's really exciting to see them. So I'm delighted, and I'm so glad you were all able to join today. And please, if there's anything else I can do to help you, reach out. And if it's not through me, I will find somebody who can help you. And enjoy the rest of your day.